Allegheny County's some of the restrictions on bars and restaurants are a little more tighter than the states, particularly with 11 p.m. being the cutoff for when alcohol and so that sort of thing can be sold and what have you. Do you feel like those restrictions at some point need to be at a more uniform level with the rest of the state, or are you comfortable with Allegheny County having some of those tighter restrictions?
I trust the judgment of Dr. Deborah Bogan, the health commissioner of Allegheny County. And so I think that I will defer to her in terms of what is specifically needed in Allegheny County. She has the best idea of what's going on in her county. And so I'm very comfortable with her decisions.
The positivity rate in Allegheny County has been dropping over the last couple of weeks. Now it's right around the 5 to 6% rate, which is a vast improvement from what it was in mid-July. Are you comfortable with the level it's at right now, or do you feel like in terms of being out of the woods of what appears to be this most recent surge in cases that it would need to be even significantly lower, maybe more like 3% where Philadelphia is at, for Allegheny County to be in a good place?
Well, we certainly want to see percent positivity rates at 5% or lower. And so the lower it is, the better it is. But, really the cutoff that we use is 5%. So we certainly want to continue to see the percent positivity go down in Allegheny County and throughout Western Pennsylvania.
You'd mentioned during the news conference point of contact testing and the hope that that will be in the hands of the state here in the near future. How quickly are you hoping that point of contact testing will be available to be used?
Sure. So it depends upon the setting that we're talking about. So we have heard from CMS, the Center for Medicare and Medicaid Services, that they are actually going to be sending point of care testing, antigen testing, as we talked about last week, to nursing homes in Pennsylvania and throughout the country. And so we will be working with them in terms of the protocols and working with our nursing homes in terms of that point of care testing when those machines arrive, and making sure we have enough of the kits to be able to do testing of staff and of patients. In terms of widespread point of care testing, we had a great press conference last week with OraSure, which is a Pennsylvania company in the Lehigh Valley, and they have received a grant from the Department of Community and Economic Development to be doing a rapid point of care test. It's also an antigen test. They're going to be working on having excellent accuracy. And so, the director and the president of OraSure talked about the fourth quarter. So, that would be before the end of 2020. So, we'll see what other point of care tests come nationally, but we certainly are looking forward to that type of widespread technology to be able to expand our testing.
Do you feel like that's also a time frame where there could be that more that testing would be more widely available? I know right now it's because there is a little bit of a shortage of some of the diagnostic testing. It's specifically being recommended only people who are symptomatic. Do you feel like it could be that long before that widespread testing where almost anybody can get it would be available again in Pennsylvania?
Well, so we've been working to expand testing significantly all along. We're making progress with that. We have more than 22,000 test results that come back per day on average, and I think we're doing well. We need to do even better, and we need to continue to expand testing. And right now, though, as you said, we're really looking at diagnostic testing individuals that are symptomatic, and they can do that at many hospitals and health systems, many localities such as Rite Aid and Walgreens and Walmart and CVS, et cetera, through federally qualified health centers, many different venues. But the type of widespread population-based testing, surveillance testing that you're discussing, that will require a large expansion of our testing with something like those point-of-care tests.
Is it frustrating that 6 months into this pandemic, we're still at a point where that widespread testing isn't available?
Well, it's challenging. It is challenging. Testing has been one of the most significant challenges that the United States have faced. It was very difficult at the beginning. In February, only testing was done at Atlanta at the CDC. And then I remember, in March when we could do 5 tests and we were thrilled. And then we could do 25 tests and we were even more thrilled. So, we've come a long way since then, but there are still testing challenges. A number of weeks ago, there were significant challenges getting test results back promptly from companies such as LabCorp and Quest. Both LabCorp and Quest are doing much better and getting test results to us within about 2 days, which is great. But there are shortages again of some of the different chemicals and reagents that are used in some of these testing platforms, particularly some that the hospitals and health systems has. That limits our ability to be able to get tests done, get even more tests done, and get those results rapidly. Challenges remain, and we'll continue to work through those.
And we ran a story about this about a week ago, but the issues that can exist when you have these testing lags with contact tracing, how difficult it is to contact trace when you have 3, 4, 5, 6, 7 day lags or longer. Do you feel like that problem, at least for the moment, has been somewhat resolved compared to what we saw? And where does it need to get before contact tracing could truly be as effective as it needs to be?
Sure. So yes, if you have a wait of 7, 10, 14 days until you get a test result back, it makes the case investigations really difficult, and contact tracing, to be effective, much more difficult. So if we're getting most test results back in several days, that is much better. We are expanding our nurses that do the case investigations. We're now up to over 1,200 contact tracers in Pennsylvania. And so if we can get the test back within 2 days, that's great. If we have ubiquitous point of care tests that we can get really accurate results back in 15 to 20 minutes, that makes it even better.
You just to switch gears a little bit, you spoke a little in the news conference about concerns with younger people getting COVID-19. And I was just looking at some of the data in Allegheny County. I think it was over the last 2 weeks, right around 14% of all cases were people who were 19 and under. And if that's up even about a third from what it was in mid-July when we saw the highest amount of cases. How concerned are you about school-aged kids getting COVID even before they're returning to the classroom?
So we are concerned. We're concerned about young people getting COVID-19. It's a misconception that young people don't get the illness. They do. It's a misconception that they never get sick. They can get very sick from COVID-19. They do at lower rates than seniors do, but they can get very sick from COVID-19. There is a very serious condition called MIS-C, or multi-system inflammatory syndrome in children. We have 43 children that have had confirmed MIS-C in Pennsylvania, more in the eastern part of the state than the western part of the state. And there are 19 more children under investigation. And those are very sick children at our excellent children's hospitals. So we know this can be serious, and we are concerned about rising rates in younger people in Allegheny County and actually throughout the state. This is following a trend that we've seen throughout the country, and we're going to need to watch it really, really carefully.
And just given the fact that there are going to be quite a few districts that go back with some form of in-person learning, is it natural to have to prepare that there could be that increase, maybe not in the most serious cases, but simply in the number of cases involving young people?
Yes. And so we have put out guidance and recommendations for schools in terms of whether they would consider opening in person or a blended, sometimes called a hybrid educational model, or to consider remote. And we update that every week. We've worked really, really closely with the Pennsylvania Department of Education on that. We've also put out guidance for school nurses, and we've put out guidance for schools to consider if they have positive cases, whether it's 1 or 2 or more positive cases. So all that guidance has gone out through to the schools, and the governor feels very strongly about local control for school districts, and so this is all information for the superintendents and the school boards to be taken into consideration. The other important point, though, is in terms of sports, and so the governor and I strongly feel and it is our strong recommendation, is that all school sports be postponed until January, till the beginning of January, and that all recreational sports and club sports also be postponed until January. I think that that with increasing case rates among young people, with some evidence from other states in terms of how sports have gone, I think we see the writing on the wall that Penn State saw, as well as the Big Ten and the Pac-12, and we feel those school sports should be postponed.
And that ties into a little bit of what I was thinking. What about the part of what I've heard from the school administrators is the idea of mandates, that these have been guidance the entire way. At no point was anything mandated. Is that something that you feel potentially looking back on it should have been considered just simply because there has been some confusion about what that guidance has meant?
Well, I mean, I don't think there's any confusion of what the guidance is. The governor has been extremely clear. I have been extremely clear that our recommendation for school sports and recreational sports is they be postponed. The governor feels very strongly again, though, that this should be a local decision. But the recommendation is crystal clear.
And I guess I wasn't specifically talking about school sports. I was referring more to some of the reopening procedures. An example, I did a story last week about how there were some concerns with school administrators about what social distancing was supposed to entail. The line in there was 6 feet to the maximum extent feasible. Some administrators were interpreting maximum extent feasible of we can't do 6 feet, therefore we'll go all virtual. And others were saying the maximum we can do is 3 feet, so that's what we're going to do. That seemed to cause a lot of confusion. And my question is, do you feel like there should have been some kind of mandate related to some of those guidelines that were put in place last month?
Well, again, the governor feels strongly that about local control, and that in the end, the superintendents and the school boards will make their decision. But I have been saying for weeks and weeks now that 6 feet actually means 6 feet. We also, to make sure that we were crystal clear in terms of our mask mandate throughout the state, so we put out a clarification and about the masks yesterday. We want school children to be wearing masks in school.
Just quickly on that note as well, you mentioned how there's the clarification, there was the guidance additionally that came out last week. A lot of these additional guidance had come out after districts had already made decisions. Is there any concern that this delay may have caused a district to decide a different way simply because they weren't exactly clear on what that initial guidance meant?
Well, we've been putting out guidance all along. The initial guidance from the Pennsylvania Department of Education came out in July. The initial guidance for the Pennsylvania Department of Health came out in July. And then we put out the specific guidance, really looking at the case rates that we had at the time. So, you can't anticipate what the case rates are going to be. And so I think that we put out our guidance at exactly the same right time, judging about what the recommendations were at that, last week, and what the case rates were last week.
And just my final couple of questions here, and then we'll let you go. And I appreciate you giving us so much time. On that guidance and where things go, you mentioned how things change drastically, and they can, as we've seen in Allegheny County, in a matter of a week or two, it can go from a good situation to a very dangerous situation. How do you feel right now about where Pennsylvania is as students prepare to head back to the classroom?
Well, our goal is to have Pennsylvania be in the best place possible as school starts. And I think that we are working every day to accomplish that. In the spring, through the containment efforts, and particularly through the mitigation efforts that the governor put in place with the stay-at-home orders and the closure of schools, et cetera, we were able to bend the curve significantly. And we were doing very, very well with 300 or 400 new cases a day in June. We are not an island, and so we get impacted by what's happening in other states and through travel, and also through younger people going to restaurants and bars, etc. We saw increases starting in Allegheny County in the Southwest in July, and so that resulted in the targeted mitigation efforts that Deborah Bogan put into place, and that the governor and I put into place in July in terms of restaurants, bars, etc. And we have again bent the curve in terms of the number of new cases. Today, we had 735 new cases. At our peak a month ago, we were seeing 1,200 new cases. So we have bent the curve significantly. We want to continue to do that and put Pennsylvania in the best place possible for the opening of school.
And Dr. Levine, the last thing I wanted to ask you, this is a little bit off topic, but it was something that I wanted to make sure I asked you about. My colleague, Amy Marcinkiewicz, did a story yesterday in regards to the Butler County Fair, how they had filed a lawsuit to try to allow for some operations. And part of what they did was related to the Carlisle events and the Carlisle Spring Carlisle, I should say, allowing 20,000 people, 50% capacity, 250 people indoors, which is obviously a little higher than the restrictions that was part of a settlement that was decided outside of court. My question to you is given that fact that is out there now, why are there limitations still being put on other events like the Butler County Fair? And is this something that needs to be reevaluated, since it at least appears on the surface like Carlisle may be getting some special treatment?
Well, so any type of ongoing legal issues, I can't really comment on. All I can say is that we feel very strongly about our gathering limits, both indoors and outdoors. We know that indoor gatherings in particularly can lead to the spread of COVID-19. There's also evidence that outdoor events can spread depending upon how much people social distance, depending upon whether they're wearing masks and washing their hands, etc. So we feel very strongly in terms of our gathering limits, and that's really probably all I can say given legal issues.
Just one quick follow-up on that. So the agreement was made public. So the agreement is publicly out there between the Department of Health and Carlisle Events. Is there nothing you could say in regards to why that seems to be treated differently than other major events?
Well, it went through a legal process, and then that was the result of the legal process. But I want to emphasize that, we all want to do the right thing. The governor has emphasized this over and over again. We are all interconnected in terms of this global pandemic of COVID-19. And what people do impacts their families, it impacts their communities, and it impacts our Commonwealth. And so we want people to limit their indoor gatherings to 25 or less. If they don't do that, then they are putting themselves, their families, and their community at risk. We want to limit outdoor gatherings to 250. There's a reason for that, because we want to limit the spread of this contagious virus. If people don't do that, then we are again putting people at risk, their families at risk, our community at risk, our counties at risk, and we're doing that at a time where we're trying to get kids back to school. So we really expect people to do the right thing and to follow the public health guidance. This is not a political issue. This is not a partisan issue. This is a public health issue that is being worked on at the county level, with our coordination with Dr. Bogan, being worked on at the state level, and then our coordination with other states and the federal government. We're all working towards the same thing, which is to protect the public health.
Dr. Levine, is there anything else you want to add or anything I haven't touched on?
No, that's fine. Thank you.
Thank you for taking the time. I really appreciate it.
Bye-bye now.